Hello students, today we will be looking into intellectual disability or intellectual developmental disorder. Intellectual disability is the first of the disorders that has been classified by the DSM-5 under the heading of neurodevelopmental disorders. Intellectual disability is characterized by deficits in general ability to reason, problem solving, planning, abstract thinking, judgment, academic learning, and learning from experience. For a person to be diagnosed with intellectual disability, he or she must be below the age of 18. Intellectual deficits also lead to adaptive functioning deficits. What is adaptive functioning? Adaptive functioning refers to how efficiently an individual copes with common day-to-day life demands and how they meet their standards of personal independence expected of someone from their particular age group or socio-cultural background or community settings. Now you can look at the screen for the diagnostic criteria of intellectual disability as defined by the DSM-5. So the DSM-5 lays a special emphasis on the assessment of both cognitive capacity as well as the adaptive functioning. Cognitive capacity is also can be called as the IQ of a person. So why is this sudden shift of interest from IQ levels of an individual to diagnose him or her with intellectual disability to an adaptive functioning outlook? So now we will be looking at that at a greater detail in our discussion below. Although there are certain instruments which measure the IQ levels of an individual, example Wechsler's intelligence scale for children or Stanford Binet scale, they measure the IQ of an individual, but there are certain disadvantages to only measuring the IQ of a child, as in a lack of exposure to a stimulating environment or a lack of opportunity to develop the existing cognitive skills can be the disadvantages that will be captured by these IQ instruments. With proper stimulation and early intervention, these children may increase their cognitive skills and IQ scores. So it is important that we focus on adaptive functioning as a measure of intellectual disability rather than just the IQ scores, because the IQ scores are pretty much limited to the child's environment and to the child's the necessary stimulation that he or she gets in the environment. So when these can be manipulated or when these can be bettered, even the IQ scores can be bettered. However, the adaptive functioning is the function of an individual in day-to-day life. So how is the person functioning in a day-to-day basis is our primary focus in the DSM-5. The DSM-5 uses the same specifiers as were used in the DSM-4-TR, namely mild, moderate, severe and profound. So these are the specifiers which indicate the level of severity of intellectual disability in an individual. So the DSM-5 considers adaptive functioning to occur in 3 different areas because there is a shift of focus now from IQ scores to adaptive functioning of an individual. So now we will be looking at the 3 different domains or areas in which intellectual disability can be understood, namely conceptual domain, the social domain and the practical domain. So an individual, in order to be diagnosed with intellectual disability, he or she must show impairments in at least one of the areas of these 3 that I have just mentioned, and pretty much with intellectual disability these children show deficits in a lot of areas, not just one of them, but it could be in all 3 or just 2 of them as well. So what are conceptual skills? So they are understanding language, speaking, reading, writing, counting, telling time, solving mathematical problems, having the ability to learn and remember information and skills. Now social skills. What are social skills? These are having interpersonal communication skills, following rules and engaging in social problem solving and understanding others, like showing empathy, making friends and keeping friends. So if you look at the practical skills now among the 3 domains, practical skills entail the daily living activities like taking personal care, taking safety measures for oneself and for one's family, and going to school and doing homework or doing home chores and participating in recreational activities and using money as well. So now looking at the first level of severity in intellectual disability, that is the mild level of intellectual disability. So in this mild level of intellectual disability, the IQ scores range from about 50 to 60, and this is one of the most common forms of intellectual disability that is found in these individuals, and it is also labeled as educable. The individuals who have been diagnosed with mild intellectual disability can also be labeled as educable, owing to their mild effects that the intellectual disability has on them. The symptoms are often recognized when the child enters school, when he or she faces difficulty and needs assistance in normal, typical child activities as well. There is a difficulty in learning, as we've seen before, and there is a difficulty in learning the academic skills like reading, writing, arithmetic, telling time and money, and they also would need support in areas to meet their age-related expectations. So the adults that with these intellectual disability, that is the mild intellectual disability, are equivalent to 8 to 11-year-old child. So an adult is having the capacity of an 8 to 11-year-old child here who has mild intellectual disability. So when compared with their age mates, they are impaired in aspects of abstract thinking, functioning, executive memory and short-term memory, and various other academic skills. So they fail in acquisition of general skills and knowledge and strategies, and also they face a little difficulty in their day-to-day activities. So their social interactions are also immature because they often are not able to understand or not relate to their age mates, and they are prone to risks of other situations such as being manipulated in the social life. Also, they need support in taking personal care of themselves, and they cannot perform complex tasks of the day such as planning and executing a particular events in a day, or going out for shopping or transportation all by themselves. So they always need an aid or a support to be with them at all times. Now we will be dealing with the individuals who are suffering from moderate intellectual disability. So what is this moderate intellectual disability? About 10% of the individuals diagnosed with intellectual disability fall under this category of moderate intellectual disability, and the IQ scores here range from 35 to 49. And the diagnosis of this moderate intellectual disability is done pretty early in the life, owing to the language deficits and the social interaction deficits that the child displays. And these individuals, upon rigorous training, can be taught to speak a language. However, conceptualization of learning and the rate of learning, the various social skills that a person can learn, are extremely limited in individuals suffering with moderate intellectual disability. However, the educational category that these individuals fall under is trainable. So the adults with moderate intellectual disability are equivalent to children of 4 to 7 years of age. Unlike individuals with mild intellectual disability, moderate intellectual disability individuals have many body deformities, and they have poor motor coordination skills. So they also display aggression and hostile emotional behavior towards their counterparts, but however they are pretty non-threatening and harmless. They can be taught daily routines, they can be taught to cook, to train and to work in unskilled or semi-skilled jobs. And in general, the early diagnosis and parental help and giving an adequate opportunity to learn certain trainable aspects in life can make these individuals achieve a partial independence in their life. So self-care and acceptable behavior are also part of the training, where the person can be independent to an extent. However, the accompaniment of a caregiver is a must for individuals suffering with moderate intellectual disability. Now you can take a look at the table representing various specific deficits of individuals with moderate intellectual disability in the conceptual, social and practical domains of functioning. Now moving on to the severity level of severe intellectual disability. Here the IQ ranges from 20 to 34, and the individuals diagnosed with severe intellectual disability are usually diagnosed in their infancy, because there are visible motor handicaps or sensory communication impairments seen in these children. They are diagnosed at a pretty early age. About 3 to 4% of people fall under this category of intellectual disability, and they have a greater risk of developing brain seizures or other neurological dysfunctions. Communication skills are underdeveloped, and these individuals need constant monitoring and help to get along with day-to-day activities in life. They can develop limited levels of personal hygiene, self-help skills, and always are independent on another person. Now you can take a look at the table representing various specific deficits of individuals with severe intellectual disability in the 3 domains mentioned below. Moving on to the severity level of profound intellectual disability. Here the IQ is below 20, and these individuals are severely deficit in adaptive behavior and various other basic tasks as well. Severe and profound cases of intellectual disability can readily be diagnosed in infancy, like we've seen before, owing up to their physical malfunctions and delayed development in various aspects of their life. There are a number of physical abnormalities or physical deformities or seizures and diseases of the central nervous system, retarded growth, mutism, deafness, and other physical abnormalities. With training, people with profound intellectual disability can learn to improve basic skills such as walking or talking or feeding themselves. So they need a very structured environment with close supervision and considerable help, which requires a one-on-one relationship with a caregiver. Now they tend to have poor health and low resistance, and they also have a lot of comorbidities that are associated with their profound intellectual disability, and thus they have a short life expectancy. Now you can take a look at the table which represents the specific deficits of these individuals with profound intellectual disability in the conceptual, social, and practical domains of functioning. Now let's turn to the assessment of intellectual disability and adaptive functioning. So there are a lot of tools which have been developed to assess intellectual disability, to draw an IQ score for an individual who is suffering with intellectual disability, be it in any form of severity. The instruments have been developed to provide normative information concerning the individual's IQ relative to their similar age peer group, and also to the adaptive functioning in the areas that are concerning day-to-day living. The instruments are also efficient in providing an age equivalent score, and they describe the person's current developmental level. And now the scores obtained on intellectual disability can be directly correlated. Now you can look at the screen for the commonly used tools or measurements to measure intellectual functioning and adaptive behavior. It is very important to keep in mind when the child is being interviewed by using rating scales or questionnaires to get an overall understanding of the child in various domains of his or her life. This information is usually extracted from the caregivers of the child, where we get a perspective of the different environments he's in and how he or she is functioning in those environments, along with the IQ score. Now this enables us to understand the child in a better manner. Moving on to the causes of intellectual disability. Initially, to understand the causes of intellectual disability, individuals affected were categorized into 2 groups, namely the organic group and secondly the cultural familial group. First, the group called organic group has children who have lower IQ scores, genetic disorders, biological abnormalities and comorbid conditions, and visual physical deficits or physical abnormalities, and which indicate an underlying neurological problem. So these children who fall into this category are pretty much recognizable as having lower IQ scores and also as having a profound or a severe or a moderate level of intellectual disability in them. So these children are diagnosed either at birth or in infancy, and there is a greater impairment in adaptive functioning in these individuals who fall under this category, and they have major difficulties in their day-to-day activities and functioning. These children are in drastic contrast with their normal age mates, and in terms of their cognitive ability and functioning. So they tend to have different levels of weaknesses and strengths, very specifically based to the causes of their intellectual disability. Now, the parents and siblings or relatives of these children are having normal levels of intellectual functioning, and they come from all socio-economic backgrounds. On the other hand, the cultural familial group shows no clear causes of impairments, and there is no visible abnormalities in the children who have intellectual disability and fall under this category. And these children are usually diagnosed after starting their school and have an IQ score of about 50 to 70 in between these scores. And they have no physical abnormalities like we've discussed before, and also they seldom show medical problems or other comorbidities. They are lesser impaired in adaptive functioning and live independently with support when compared to the group of children which fall under the organic intellectual disability. So this group has been called the cultural familial group, as it is believed that these children experience intellectual disability as a result of an interplay between the environmental and the genetic factors. Now, moving on to another explanation, a bettered explanation of the two groups that we've just seen, the organic and the cultural familial group, is the behavior phenotype. What is the behavior phenotype? A behavioral phenotype is the heightened probability or likelihood that people with a given syndrome will exhibit certain behavioral or developmental sequel relative to those without the syndrome. A child with intellectual disability displays different characteristic patterns of cognitive abilities, and it is important to identify the specific cognitive and behavioral aspects associated with the disability rather than clubbing all the children into the organic group. So, behavioral phenotype includes the appearance, overall intellectual ability, and the adaptive functioning and cognitive strengths and weaknesses, co-occurring physical and psychiatric disorders, the medical complications, and also the developmental outcomes of children with specific causes of their intellectual disability. The process of identifying behavioral phenotype given a general description of the features associated with the disorder, and it is useful in understanding the specific strengths and weaknesses associated with intellectual disability. Now, there are more integrated approaches that have been adapted to understand the risk factors, causes, and the implications of intellectual disability. The risk factors or the causes of intellectual disability can be broadly classified into two categories, that is, the biological category and the psychosocial category. Now, the biological category of causes of intellectual disability are classified into three main groups, that is, the prenatal, the perinatal, and the postnatal causes of intellectual disability. The biological classification of the causes of intellectual disability focuses mainly on the damage that has occurred to an individual in aspects of his physical functioning and the central nervous system and the development of the neurological facilities. As part of the biological causes of intellectual disability, a list of conditions and disorders occurring at the prenatal, perinatal, and postnatal stages of development are tabulated here. In this section, we will discuss some of the commonly occurring diseases among these individuals with intellectual disability. Now, looking at the prenatal causes, we can understand that there are certain chromosomal disorders that can arise in these individuals suffering with intellectual disability. The most common form of chromosomal disorder that has been seen across individuals suffering with intellectual disability is the Down syndrome. Approximately 1 in 1,000 children are affected by this disorder, the Down syndrome, and the mother's age is directly correlated with the individual or with the infant developing this disorder. If the mother's age is beyond 35, then the risk of the child developing a Down syndrome is higher. The genetic anomalies involved in the Down syndrome is caused due to the development of abnormality in the chromosome 21, resulting in a trisomy. leading to 47 chromosomes rather than 46. So there is an extra chromosome that is adding to the children who are suffering with Down syndrome. Now let's look at the characteristic features of Down syndrome. So the children who are suffering with Down syndrome have physical abnormalities such as almond-shaped eyes, and there is a thickness of skin near the eyelids of the children, and the face and the nose and the back of the head are flat, and the tongue is abnormally large for the mouth, and there are deep fissures on the tongue, and there are speckled eyes usually seen among these children, and the figures and they are usually short, and also the fingers are stubby and little, and the little finger is abnormally curved when compared to the other fingers of the child, and their brain size is also small, and they experience accelerated aging, and their survivorship is, it goes up to 40, and even if individual with Down syndrome survives up to 40, then they are more likely to develop symptoms of Alzheimer's and dementia. And associated comorbidities, the medical comorbidities of these children could be congenital heart disorders and thyroid functions, leukemia, respiratory problems, etc. However, there is a life expectancy of until 65 years for these children, which can be considered as a strength in the biological domain of children having Down syndrome. Then coming to the social aspects of it, the weaknesses in the social aspects, the domain or social domain, is social isolation and stigma because of their visual features that we've mentioned just before. And also there is a lot of dependence on a caregiver by these children, and they usually hail from lower socioeconomic backgrounds. And their strengths in the social domain are they're very friendly and amiable and outgoing, and are affectionate towards others, which makes them have pretty good relationships with at least a certain amount of people. Owing to the weaknesses in the behavioral aspects of these children of Down syndrome, they have emotional and behavioral problems owing to their intellectual disability, and they have problems in regulating their emotions more often than not, and there is a decline in developmental progress of this particular child in all aspects of their behavior. Now, understanding the strengths of the aspects of children suffering with Down syndrome is that they are less prone to develop psychiatric disorders. Now, understanding the weaknesses in the aspects of education and academics is that they have a lot of difficulty in understanding and functioning academically, and they show significant deficits in learning and using the simplistic grammar that they've learnt and the vocabulary that they've learnt. So sentence structuring and formulating and articulating is very impaired in these children. So problems with auditory learning and short-term memory can also be seen in these individuals with Down syndrome, and also their parents have less IQ. The strengths in the educational domain of these individuals is that they show relatively greater strength in spatio-visual reasoning. They can repeat a series of hand movements presented visually to them rather than telling it to them in repetition in verbal forms. This can be of alphabets or numbers, and they have a strength in the spatio-visual representation of these various skills that they've learnt. Now we will look at another chromosomal disorder called the Prader-Willi chromosomal disorder. So this is a non-inherited genetic disorder characterized by mild intellectual functioning. The prevalence or the rate of this disorder is up to 5 to 10% in individuals suffering with intellectual disability. The syndrome is caused as a result of deletion of genetic information on the 15th chromosome. So if we look at the biological, social and behavioral and educational aspects or domains of functioning of these individuals with Prader-Willi syndrome, we can see that they have a lot of physical disability as well. So they are short in stature, they have problems with feeding, and they have a significant problem with gaining weight. They have incomplete sexual development, and they have low muscle tone, and between the age of 2 and 6 there is a drastic change in the eating pattern of these children. They tend to eat a lot in this age, and this tends to show an effect on their body weight and the development of other medical conditions or comorbidities, and this also has an effect on their life expectancy. Now, moving to the social weaknesses that these children have, they can show oppositional behavior and hostile behavior towards adults. As we've seen, the behavioral weaknesses in these children are overeating and obesity, and adaptive behavioral deficits, and also very lower levels of IQ, and argumentativeness, being defiant and throwing tantrums towards their superior figures. And also 42% of the children with this disorder, with this syndrome, destroy property. They show symptoms of vandalism and physical attacks on others as well. They tend to develop psychiatric disorders and have distorted thinking, and also tend to have illusions and hallucinate more often than other children with other chromosomal disorders, and they have symptoms of OCD as well. Now, looking at the educational domain, and the weaknesses in the educational domain are related to the memory. The short-term memory is very impaired in these children, and the strengths in educational aspects of these children suffering from Prader-Willi syndrome is that they show a relatively greater skill of reasoning in the area of spatio-visual reasoning, just like the children with Down syndrome show. Moving on, yet another chromosomal disorder that we will be discussing today is the Angelman syndrome. So, the Angelman syndrome was discovered first by Harry Angelman, and the intellectual functioning of children affected by this syndrome are between the levels of severe and profound intellectual disability. So, it affects 1% of the children suffering from intellectual disability. The syndrome is caused by the abnormalities on portions of the chromosome 15, similar to Prader-Willi syndrome, where there is a chromosome deletion. However, here there are abnormalities on the gene, while PWS, Prader-Willi syndrome, is characterized by the missing genetic information from the father. Here, Angelman syndrome is characterized by the missing information from the mother on chromosome 15. Up to 70% of cases have genetic information missing from their mother completely, and up to 3 to 5% of the cases receive 2 chromosomes from the father, and some undergo genetic mutation as well. Looking at the characteristic features of Angelman syndrome, the biological weaknesses displayed by these children are they have an unusual grit or a smiling mouth, which does not tend to return back to normalcy under normal conditions. They have a thin upper lip, they have a pointed chin and a larger jaw, and open mouth expressions are common among these individuals. And hypopigmentation, that is being very pale and having light colored eyes, is also characteristic of these children, and 90% of these children are prone to developing seizures. Life expectancy depends on the severity of other comorbid conditions that these children have, and especially the seizures are more prominently seen among these children and may lead to death as well. Now, the weaknesses in behavioral aspects of these children with Angelman syndrome are that they show unusual motor behavior, walking with arms lifted high and toes wide apart and leaning forward while walking. They also show hyperactivity and inattentiveness, and this also hinders their ability to sleep properly because they are always hyperactive and cannot focus or cannot fall asleep due to this particular symptom. They are also easily excited, and there is a difficulty in sustaining their attention on one task given to them. And looking at the weaknesses in the educational domain of these individuals is that they have short-term memory loss and also developmental impairments. They also show a lack of educational learning and deficits in cognitive capacity, and their speech is also impaired. Moving on, we shall discuss another chromosomal disorder called the Williams syndrome, which has been first discovered by J.C.P. Williams and is called the Williams-Brunner syndrome. This chromosome disorder, where a microdeletion occurs on a small portion of chromosome 7, and the deletion of 26th or 28th gene on this chromosome is also seen in these individuals, and this 26th or 28th gene is very much related to the production of elastin gene on the chromosome. and the gene that codes for an enzyme called LIM kinase is also missing from these individuals. Now that we've seen a lot of chromosomal disorders that can cause intellectual disability, now we will be looking at a metabolic disorder that can cause intellectual disability. Phenylketonuria, or PKU as it is called, is one of the common metabolic disorders that can occur in children and can lead to intellectual disability if untreated. What happens in this disorder is that amino acid, which is very important for the development of the brain and the body, called phenylalanine, is essential for the body. However, it cannot be produced by the body. Thus, it has to be taken from certain foods like dairy or meats. So, when the body of the child fails to convert this amino acid, it becomes a toxic product for the brain functioning. Other chromosomal disorders can be the Rett syndrome or the Williams syndrome, and also there are some metabolic disorders which can cause intellectual disability, such as the phenylketonuria disorder, which also can contribute to a child developing intellectual disability. Other diseases related to the mother's health, that is the maternal illness, can also cause intellectual disability in children. Infections such as the toxoplasma and rubella, or the HIV/AIDS, hepatitis B, and the herpes simplex virus also can cause intellectual disability among children. And environmental toxins such as exposure to lead and fetal alcohol syndrome can also cause intellectual disability in children, causing mild to profound levels of intellectual disability related to the exposure that a person has during during the pregnancy to lead exposure as well as the alcohol consumption. Now let's look at the perinatal causes of intellectual disability. Perinatal causes of intellectual disability can be described as the complications that occur during the gestation period or the delivery period of a child. Problems such as the anoxia, and that is the child losing the supply of oxygen during the process of delivery or after birth can also cause intellectual disability in the child. And premature birth can also be a reason for intellectual disability in many children. Conditions such as gestational diabetes or hypertension are also associated with intellectual disability in children. Malnutrition of the mother or the child can also result in intellectual disability. Now, looking at the postnatal causes of intellectual disability, childhood illness or injury such as infections to the brain like the encephalitis or the meningitis can also cause intellectual disability in children, because there is a lot of damage that occurs due to these infections in the child's nervous system or the brain. And the injuries to the head and being poisoned physically or drowning or having physical traumas to the child's head or other parts of the body can also lead to intellectual disability among children. Now let's look at the psychosocial causes of intellectual disability. Together, the psychosocial causes of intellectual disability can amount up to 15 to 20% of intellectual disability, and here the child is deprived of basic amenities such as a stimulating environment or a proper teaching of a language or ways to improve their cognitive skills in their environments that they are in. And usually environmental deprivation can also include poor access to health, inadequate nutrition, lack of cognitive stimulation, and early childhood injuries. And low quality of early education can also be a cause of the psychosocial factors that could cause intellectual disability. If we can see a study done on examining the MRI scans of the brain size of children who hail from low socioeconomic backgrounds and who hail from normal socioeconomic backgrounds, say middle class, there are differences in the brain scans of these children owing to the brain size in areas especially related to problem solving and memories of the child, because of their lack of opportunity to view various aspects of their learning during their childhood. This can occur is one of the premise of the causes of psychosocial illnesses, psychosocial intellectual disability among children. Now let's look at the interventions for intellectual disability. Prenatal care and early childhood interventions. So prenatal care includes providing information to the parents, such as providing them with psychoeducation modules where they understand the health of the child is priority here, and they also understand that various exposure to various aspects like being exposed to alcohol or the lead exposure like we've discussed earlier, and the consumption of alcohol or other drugs can be associated to the development of intellectual disability among these children. So if you look at the community programs that have been designed to educate the parents and their relatives or family members are very much culture specific. This is because there should not be a clash between the medical facts and the cultural aspects of how a particular person goes about understanding pregnancy or behaving in a particular pregnancy. Now let's look at the preschool interventions that are designed for children to enhance their level of adaptive function. So preschool programs or early childhood interventions can significantly increase a child's cognitive skills. So preschool programs that focus on social and emotional functioning can improve behavioral inhibitions and attention in children. Longitudinal studies also show that repeated exposure to preschool education, that is educating these children with lower IQ levels or adaptive functioning with modules that can equip them with more information regarding their study material or interacting with their peers, can actually show an increase in the performance of these children with intellectual disability. Now moving on to the cognitive and behavioral treatments that are there for intellectual disability. Cognitive behavioral techniques such as contingency management training, shaping, modeling, verbal self-regulation and behavioral inhibitions are among the various techniques that can be used to treat children, help them manage their intellectual disability, the deficits that are caused by the intellectual disability in terms of learning, academic skills, communication, peer group interactions. All of these aspects can be targeted and managed with behavioral and cognitive techniques. Now moving on to the family-based interventions that are existing for children with intellectual disability. Here the parents are taught about the disability of the child, and this can be viewed in 3 phases. The first phase is when the child, after the gestation, after the birth of the child, what are the various care aspects that are supposed to be concerned with the improvement of the intellectual abilities of a child. The second phase is when the child joins school. How can the parents and the relatives of the child can integrate various educational methods to teach the child to adapt well to their environments and learn efficiently. And thirdly, during the phase of their adolescence, where the parents may have to deal with the emotional aspects that emerge during the child's adolescence, and thus the training of the parents in treating or managing intellectual disability can be fallen into these 3 categories and explained to the child and learnt during the course of development for better functioning and adaptive management. So as we've seen, students, we have learnt about intellectual disability as defined by the DSM-5, as opposed to it being called mental retardation in the DSM-4 TR or DSM-4, and we have also seen the levels of intellectual disability. We have seen the various instruments that can assess intellectual disability, and we've seen the biological as well as the psychosocial causes of intellectual disability and the various treatment measures that are there for intellectual disability. For a detailed picture of the biological causes as well as the therapies that are available for intellectual disability, kindly view the script. Thank you.